The International Forum for Promoting Homeopathy was formed by a group of homeopathy lovers, students, and homeopathic doctors. And already doctors from 65 countries presented different subjects on this platform. And we have 3 sessions in a row now. The first session is already over by just a few minutes ago. It was Hindi session, and now we have an international session from 8 to 9 in English, and 9 to 10, we have a local language session in Malayalam. As you all know that today our guest is Dr. Rajeshwari Rapta. She has presented so many presentations in this forum earlier. All the presentations were really excellent. And today, let me introduce our doctor once again. She has completed her DHMS and then took MBA in hospital and healthcare administration as a certified weight loss coach, a diploma in psychology, counseling, and BLS and ACLS are certificate courses from European guidelines. And she was the former principal, hospital administrator, ex-professor, HOD anatomy by MUHS Nausik, Maharashtra. Her expertise include homeopathy consultation, academic management, counseling, hospital administration, teaching, training, and internal auditing of hospitals. She is the founder of the Art of Healing Gurukul. And though her project Her Homeopathy, she is on a mission to skill India on awareness of medical emergency conditions, CPR, first aid, and the role of homeopathy. The scientific and medical writing was a part of her work, but she had started feeding her flair and for the contemporary writing recently and contributed articles and poems to various anthological of English Publishing House. She was awarded IFPH Adventure Writer Award 2020, the Best Teacher Award 2020, and the Bharat Chikitsa Gaurav Award 2021. She is an avid traveler, podcaster, YouTuber, loves singing and cooking, as you know. That was, and she had, you can see her website, uh, as well as she used to write in LinkedIn, and you can see her Instagram page, blog page, everything were written in our, and even in Facebook, and all those things were written in our poster. So everybody, all of you should can visit her sites in different sessions of this Facebook, Twitter, Instagram, like that. Anyway, let us discuss about the subject of the day, that is first aid in homeopathy and scope of homeopathic medicine in emergency. As you all know that homeopathy can do a lot of wonders in emergency conditions. And so Dr. Rajeshwari Rapta will be discussing about all these things. So you can use these things to save the patients in first aid conditions. Welcome, madam.
Namaste and good evening, everyone. Thank you for the wonderful introduction, Dr. Danesh sir. I'm grateful to IFPH and our respected Sahani sir, Dr. Sahani sir, and all our esteemed members of this group for giving me this opportunity and to present this webinar here on the IFPH platform. So today's my topic is first aid in homeopathy and scope of homeopathy in emergency medicine. It was in 2017, ending of 2016, where this came into my mind that it is very important that homeopathy should be explored, should be exploring emergency medicine. And we all know that homeopathy, many people are aware that they only know that homeopathy works in chronic conditions, but they're not aware that it also works wonderfully in acute conditions. We as doctors have also experienced such wonderful cures in acute cases. So why not explore homeopathy in acute conditions and as in first aid and emergency medicine? I was nominated as president of WICCI Homeopathy Council as a president, and we formed an all-women National Homeopathy Council under the WICCI, that is the Women in the Indian Chamber of Commerce and Industry. And then we decided that our mission will be to spread the awareness in the emergency medicine or emergency homeopathy. So that's where the first aid course arose. And then we have around 140 members from all around the states. And slowly the numbers are increasing too. I have trained around 1,000 candidates. And recently I conducted a 8-day online course, that is a train the trainer training program, where we trained all our council members who are delegated the training work and other activities as ambassadors of the first aid homeopathy course. I had sent the YouTube links. If you want, I can send the YouTube links once again for the 8-day course. And if anyone is interested to learn, we can conduct the same for you. Just like Dr. Saptarshi has described about ECG, it is one of the part of this program where every homeopathic doctor should know about the ECG, should learn about the ECG, especially the ventricular fibrillation and atrial fibrillation, the different kinds of blocks. And then it's very important to identify the condition. And CPR is also part of this training. So we can conduct the same for anyone who is interested. They can directly message me, or you can email me as well. I take similar workshops on first aid, homeopathy, and CPR training in schools as well as colleges, online as well as offline. So that's about the introduction of how this course arose. Now, let me share the slides with you. The first aid, our first topic is the first aid in homeopathy and scope in emergency medicine. So here are the books which I had referred, and there were several mentors also who mentored me to, form this course and how to take the training and how to create the awareness. So I'm grateful to those mentors as well.
Yes, we can see the slide.
Yeah. So vision of this Ghar Ghar Homeopathy project, which comes under this, first aid course in homeopathy. So Ghar Ghar Homeopathic project, it is the initiative of our the Art of Healing Gurukul Academy under WICCI. And it is for the disaster prepared and skilled nation. In COVID-19, we have seen that how the disaster, made a hell of out of the situation. Awareness of homeopathy in first aid and emergency, that's what we create. And strengthening the nation by empowering the people's attitude to rescue and play a good Samaritan. We know that thousands of deaths happen due to road traffic accidents, due to several, emergency medical conditions, due to, bites of wild animals, you can say, due to poisoning. So several cases due to which deaths happen, and where, homeopathy can also play a very important role. This is also to strengthen the government's efforts to reduce and overcome the mortality rate. Also to promote the use of homeopathy, to bring the homeopathy to integrate with the mainstream emergency medicine. We all see that in many of the hospitals where, when we go to the ICU or into the wards, there we find that homeopathy is not available. So this is also a venture to bring homeopathy into mainstream emergency medicine. Then we also provide these courses and make awareness in schools and colleges where the Ghar Ghar Chota Doctor. So this initiative is also carried on for the children, school-going children. Now, these are the conditions, environmental injuries and illnesses, where we create a awareness about different medical emergency conditions. So how how these medical conditions, emergency conditions arise. It can be due to environmental injuries and illnesses. It can be because of the medical problems like bleeding, teeth injuries, nosebleeds, punctured and impaled objects, eye problems, injuries, spine injuries, bone injuries, joint injuries, burns and electrical injuries, drowning. And that's where we teach about the homeopathic medicines in the first aid, which everyone can use easily. So we create awareness of different emergency medical conditions and how to use the homeopathic medicines for these conditions as first aid. So this is very important for everyone to know, and to know that homeopathy also works in acute conditions. Bites and stings, temperature-related illnesses, hyperthermia, sunburns, frostbite, hypothermia, epilepsy, toxin and poison exposure, bandages, splinting, transportation of the injured, and CPR and Heimlich's manual. All this is taught in this course. So I'm just giving a short brief of these conditions, but in the course we teach in detail about everything. So this about this is a choking first aid, Heimlich's maneuver, which we also teach, and the CPR method also we teach. So both the CPR and the hands-on method, both we teach, train them. And then you see, this is the CPR, how it is conducted. So on the dummy, we train the people how to do the CPR. Now coming to the classification of diseases in homeopathy and concept of emergency medicine in homeopathy. So in Organon of Medicine, where Dr. Hahnemann had already written Odes Apere, so that we can understand and explore the unexplored things. Okay. And in homeopathy, the diseases are classified into 4 major groups. One is indisposition. Indisposition itself is related to the acute condition. So diseases, second one is diseases due to mechanical and external sources. It can be surgical conditions as well, or due to accidents or falls. Any acute diseases and chronic diseases. In this way, 4 categories are there in the as a disease classification. Now coming to indisposition, in aphorism 150 of Organon of Medicine, Dr. Master Hahnemann says that about indisposition, if a patient complains of one or more trivial symptoms that have been only observed a short time previously, and the physician should not disregard this as a fully developed case that requires serious medical aid. So should not be disregarded. That is, it is called as. So you should understand that even in indisposition, it can be slight uneasy feeling that can go into acute exacerbation of a chronic disease as well. So there can be variations here, and that can be considered as an acute condition. And coming to next one, that is disease due to mechanical or external sources. These include fractures, strains, poisoning, exposure to extremes of heat or cold like frostbite or sunstroke, and these diseases may be caused by some mechanical means or external sources. Now, these are mainly self-curative or can be set right by regulating environment or by precipitating cause. And medicines can be used to assist or hasten the process of recovery. So here, most important thing Dr. Hahnemann has mentioned is removal of the causative factor. And if it still persists, it is the first procedure to be followed for cure. So removal of the causative factor, again, it is a mechanical intervention, or it can be, the maintaining cause. That is what is mentioned. And it may involve surgical procedure or rectifying the diet or removal of the irritating substance. So this is the disease classification, second one. Coming to the third one is acute diseases. Now this is directly related to the emergency homeopathy. From aphorism 72 and 73 of Organon of Medicine, there Dr. Hahnemann mentions acute diseases are the result of rapid morbid process of deranged vital force, and their onset is sudden, have a definite course and quick expression of action, and they terminate within a short time, either with a complete recovery or with the death of the patient. Now here we have to bridge the gap between complete recovery or the death of the patient. That is what where the role of emergency homeopathy comes into play. Next, acute diseases can be classified again into 4 groups. That is individual diseases, sporadic diseases, epidemic diseases, endemic diseases. One-sided diseases, that is mental or physical disease with few symptoms, and local maladies. Now, all these conditions, we can see that homeopathy plays a very important role. It is there is a lot of evidences since Dr. Hahnemann's times that how homeopathy has played a very important role in saving so many people's lives. In epidemics, you say epidemics of measles or cholera or the scarlet fever, you say. So in one-sided diseases as well, the mental diseases, acute psychiatric complaints, you say, homeopathy plays a very important role. Now, coming to individual diseases, these acute diseases attack human beings individually, like excessive eating, exposures to extremes of temperature, to storms, mental emotions, etc. are some of the causes for this kind of acute individual diseases. So there can be transient explosion of latent sora. If you go to the miasms, that is what is the explanation there. Transient explosion of latent sora, which soon returns to its dormant state after the individual is relieved of his sufferings. So these can be acute exacerbations as well of the chronic diseases. Now, sporadic diseases. These acute diseases attack several persons at the same time here and there due to climatic or telluric influences and injurious agents. In this case, the susceptibility is morbidly affected in few persons. And that is at the same time. At one time you can see. So here also homeopathy plays a very important role. Epidemic diseases, many persons attacked with the similar sufferings from the same cause, and these diseases usually become infectious when they are prevalent about thickly populated regions, poor sanitation at large gatherings like fairs, wars, natural calamities like earthquakes, famines, calamities of war. So all these conditions excite them, and then many large people are affected at the same time. It can be typhoid, it can be cholera, mumps, measles. Now here also homeopathy plays a very important role. Endemic diseases, here the diseases continuously prevail in a community and the time attacking many persons with a similar suffering at the same time. And these diseases are again infectious. Now coming to the palliative medicine or emergency medicine, suspended animation, which is mentioned in aphorism 67. And about emergency medicine or palliative medicine, Dr. Hahnemann explains in the aphorism 61 to 70. Now, what does Dr. Stuart Claus say about bedridden patient? Okay, when we talk about emergency medicine or palliative medicine, okay, the picture of the ICU ward or emergency unit comes before our eyes, isn't it? So that's where the patient is confined to the bed and the examiner will observe his position in the bed, his manner of moving or turning, about his respiration, observe the respiration, how fast is his respiration and how deep is his respiration, how are the respiratory muscles working. All this we have studied in our clinical skills. The state of his skin, color and order of perspiration, the order of exhalations from mouth and body, physical appearance of the atmosphere and temperature as known, as shown in the amount of covering, ventilation of the room, the ice bags, hot water bottles, etc. All these are mentioned in the organon of medicine. which was written during that time, which all these observations are still being carried out till now. Without this, only the investigations will not help, and as a homeopathic doctor, we know it much better that these observations are very important. So all these things uh, are noticed by the alert examiner, perhaps without asking a question, will be valuable guides in the choice of the remedy, and that should be noted. You know, so when a bedridden patient is there or unconscious patient is there, a person is on a ventilator is there, he'll not be able to speak. So all these things, the observations are very important to guess the remedy, to get the remedy. Now about exploring and applying the homeopathic therapeutics in different dimensions, how we will explore the different dimensions by using homeopathy, where homeopathy can be considered and explored. Some of the NABH control standards. Now, what is NABH quality control? That is every hospital, which really wants to give insurance claims to the people, patients. The patients claim the insurance, isn't it? Mediclaim policies they have. So when they have to claim it, the hospital should be recognized, accredited under the NABH. That is what the IRDA gives is the rules of the IRDA. So under these NABH quality control standards, under the accreditation, all these standards are have to be monitored and updated regularly in the different journals. And these are central line associated bloodstream infection, that's called as CLABSI, and surgical site infection, ventilator associated pneumonia, catheter associated urinary tract infections, COTI. These are some of the very important standards. Right? And daily it is monitored and seen that how many patients are, infected due to central line, how many, infections happen due to surgical site, and how the, per bed, how the discharge, it's becoming late. So, and catheter associated tract infections also. All these are monitored. Other cases where homeopathy can be applied is septicemia, shock, pre and post-operative care, and wound wash and care using calendula. Nowadays, you see that many of the hospitals have adopted calendula, which is also a broad spectrum, like a broad spectrum antibiotic, useful for many kinds of infections. Apersulf, Mangifera, Myristica, all these are very important medicines which can be used as preoperative and postoperative care. And oral care, oral hygiene, decubitus ulcers, after effects of anesthesia, all these are important. Now, scope of homeopathy as the emergency medicine. Now, keeping COVID-19 in mind and to make a disaster prepared nation in case of any unfortunate crisis or any other pandemic, we have already seen in the COVID-19 that how people were affected. And there will be a need of skilled professionals, personals, and a brigade of lifesavers and first responders for the national health safety. And that's why every homeopath should be prepared for it. By learning homeopathy to use it in acute conditions. So with a slogan of health is your birthright and the right to choice of treatment. Now, what is this right to choice of treatment? That every patient has a right to choose what kind of treatment he needs. Apart from being admitted to the hospitals and getting all the mechanical procedures done to them and suffering the side effects and different other sufferings, they need to also get the treatment of homeopathy or other Ayush treatments. So that is their right to choice of treatment, and they can demand it and they should get it. That is a human right. So the right to choice of treatment for every human citizen is essential ingredient of good hospital and healthcare services. So it is recommended that every hospital should provide all the different treatments which are necessary for a human, a patient should to get better and to recover fast. There are lakhs of homeopathic doctors and billions of patients in the country who take homeopathic treatment, and then they get relieved of that complaints. We all know that. And homeopathy being a popular system of medicine amongst the elite, the cosmopolitan, and the urban and the rural area alike has to be integrated into the mainstream medicine in the hospitals. I know that you all agree with this. So Ghar Ghar Homeopathy project proposal is for training 1 million people across India in awareness of emergency medical conditions, first aid role of homeopathy in these conditions. So it is very crucial for not only for doctors, but every citizen, as you never know when a national disaster or crisis can arise in any form. This course is conducted online as well as offline. And this is where my mission is to spread the awareness of homeopathy from Kashmir to Kanyakumari and Guwahati to Gujarat. And later, if God helps, that is, later I will turn to globally also. Now coming to scope of homeopathy as a emergency medicine, different conditions in emergency department. It can be right from trauma, psychological emergency, psychiatric emergencies, external or internal injuries, trauma, burns, it may be superficial or deep burns, to counteract side effects of medicine and procedures in intensive care unit, cardiac unit as well, neonatal intensive care unit, pediatric intensive care unit, in obstetric and gynecology emergencies, palliative care unit, the terminal care and end of life care. Till then, the homeopathy can play a very important role. Now, how it can play an important role? There is something called as DALI. DALI is to reduce the disability adjusted life years. So how does this happen? Due to many emergency conditions, like suppose you say stroke or sudden blindness due to some cause, some medical condition. Okay, that's where the patient, in spite of being healthy, becomes disabled. Or it can be premature death. Okay, post-stroke, when the person goes into paralysis, in spite of being younger in age, is unable to work or be productive in life. So post-operative, conditions where a person can become disabled. It can be heart surgeries, post-operative heart surgeries, post-orthopedic surgeries, any such conditions, which can produce a disability to the person, and the person has to adjust the less rest of his life. His life becomes unproductive, okay, and disabled. That is DALI. To reduce the DALI, to reduce the disability adjusted life years, homeopathy can play a very important role. Okay. So in 2017, India had about 9.5 million deaths and around 486 million DALIs. 486 million is not less number. So the ratio of DALIs to deaths was about 50 to 1 as stated by the Lancet studies. You can imagine it's a huge number. So this is where homeopathy can play a very important role. Even COVID-19 studies, they say that the highest DALIs were reported in persons from 51 to 60 years. 51 to 60 years is a highly productive area. That is where people work very hard and, they are very productive. So this is where homeopathy plays a very important role to increase the productive life of the human being, to, reduce the DALIs. Also, observational studies based on the evidence-based medicine were conducted by the Society of Critical Care for the ABCDE bundle performance. Now you will ask me, what is ABCDE bundle performance? And that was for 3 sets of outcome, that is patient related, related to mortality, ICU, and hospital discharge. Okay, so patient related and symptom related, that will be mechanical ventilation, coma, delirium, pain, and restraint use. Then third was system related, that is ICU readmission and discharge destination. That is after discharge, what happened to the patient, whether he was shifted to some other department or whether he went to home healthy or whether it was terminal, that is death. So ABCDEF bundle, it is a collection of 6 elements which represents an evidence-based approach for clinicians to optimize patient recovery and outcomes in ICU. The guidelines for prevention and management of pain, agitation, sedation, delirium, immobility, sleep disruption in the ICU, nutritional guidelines were the key elements that have been shown not only to decrease the mortality and morbidity, but also to rehabilitate functional abilities and health-related quality of life. Now, I'm asking you one question. Why can't homeopathic hospitals or any college hospitals, teaching hospitals, conduct such kind of research work where they, apply the homeopathic medicines in the ICUs as well as the wards or in the emergency department, and conduct such kind of research where, you'll be able to prove that homeopathy works in these emergency. We already know that it works. There have been so many cases written by Dr. Parikh in his emergency homeopathy book, by Dr. Michael Frass in his book, and another book which I mentioned. So there are many research papers also which have been written, but in India, why is it not properly applicable or applied in all hospitals and sent to the government that this works in this way? So a variety of guidelines recommend incorporation of these evidence-based approaches into clinical practice according to the local situation and available resources. When this ABCDEF bundle was researched, studied, and the primary outcome was implementation of the each element, about the 3 elements. Yeah, I'm not moving the slide. Can you see the slide?
Yes.
Oh, okay. So these implementation, the primary outcome was implementation of each element, and the following elements associated with the bundle were examined. The presence of the target goal was pain and sedation management. Now, homeopathy also works as a pain medicine. So many beautiful medicines, we have to reduce the pain without any side effects. That we can study. The Glasgow scale, coma scale is there, the different elements, which help to study us, the patient's outcome. We have to implement those and find out how homeopathy works and show it as a proof that it indeed works, and that, will reduce the suffering of the patient. It will increase the mortality, it will decrease the mortality rate, and it will also decrease the stay in the hospital, patient stay in the hospital. Now, coming to sleep assessment, the implementation of nutrition therapy, the ICU diary was implemented in this ABCDF bundle, where the patient was required to make a diary and write down whatever is happening to him, what are his feelings and all that, so that reduces his anxiety level in the hospital. Now, we know how many medicines we have in homeopathy to reduce the anxiety, to reduce the nervousness, to reduce the panic when the person is getting admitted into the hospital for a very major surgery. We have those medicines. The use of physical restraints. In some conditions, the patients are tied, the hands are tied, the legs are tied, the different restraints are used. So that was also monitored. The route and the amount of energy and the protein in nutrition were investigated. So here the role of the physiotherapist, the role of the nutritionist come, the role of psychological counselors come. Why not the role of homeopathic physician? That's what is my question. So we have to keep this in mind and implement this in the hospitals, in teaching hospitals, as well as various homeopathic hospitals, as well as collaborate with the conventional system medicine, and also do this experimentations and research. The association between implementation of ICU care and ICU structure, including the presence of specific protocols, the frequency of multidisciplinary or multi-professional rounds, the nurse to patient ratio, the number of ICU beds exclusively for the patients uh, with various infections, the presence of dedicated physiotherapists and ability of physiotherapists to enter the room of the patient, all these things were monitored. And here only one question comes, why not homeopaths? So this we have to keep in mind and implement it in emergency medicine and all these different wards. So my question is here that homeopathy works in the emergency medicine and it has to be implemented in all these departments. So this is what we discussed to prevent the DALI, disability adjusted life years, premature death, and central line associated bloodstream infection, the surgical site infections. We have different medicines for this. We'll discuss these medicines as well. Now, Dr. Michael Frass tells us about a case. When I was taking the 8-day training course for the Train the Trainer program, we had invited Dr. Michael Frass as a speaker. And he told us about a case of HELP syndrome, which was treated by homeopathic medicines, that is sodium chloratum, lachesis, and cretaceous. So what is HELP syndrome? Hemolysis, elevated liver enzymes, low platelet count. Okay, all these makes a HELP syndrome. And it develops before the 37th week of the pregnancy, and it can also occur shortly after delivery. So many women are diagnosed with preeclampsia beforehand. And symptoms will include nausea, headache, stomach pain, swelling, high blood pressure. And this treatment usually requires delivery of the baby, even if the baby is premature. That's where homeopathy works. Now, isn't it an emergency condition? Also, he explains or discussed about acute myocardial infarction requiring resuscitation. Okay, this case was treated by carbo-veg. Now, most of these cases were hopeless cases where the conventional system had failed. They said that now there is no, hope of this patient surviving. And that's where Dr. Michael Frass was handed over this case, and he took the initiative by giving homeopathy. And the patient was saved. So when there is a hope of saving a person in such critical terminal cases, it gives, so much importance to homeopathy. Also, he discussed about a case of multi-organ failure after replacement of ascending aorta and replacement of the ascending aorta and the aortic valve implantation. And that was treated by Cortalis, Cascavella, and Phosphorus and Heppersulf. He also discussed about the another case of severe hypoxic cerebral insult during general anesthesia. General anesthesia can sometimes have severe effects, severe conditions. It can lead to emergency sometime, and that can also be saved by homeopathy. So there, Laurocerasus was given, and the patient was, saved. Also, there was one case which he discussed, post-operative ARDS, which was, helped by carbo-veg, which we rightly call as a, medicine for death saving person, corpse reviver, it's called as. Also, weaning problem after surgery by sulfur, causticum, lycopodium, and hyoscyamus. Also, there are cases of delirium. In hospital, frequently we find delirium cases, okay, in sepsis, in trauma, and also in the after the surgeries, anesthesia effect. Stramonium and belladonna was used, which also helped the cases. Threatened abortion was treated by pulsatile and the patient survived. So in this way, so many medicines are important and can be used in such conditions. Also, psychiatric emergency. We all know that Ignatia is such a beautiful medicine. Aconite is such a beautiful medicine which can be used in psychiatric emergencies. I have used personally Ignatia and Rescue Remedy in such emergency acute conditions. Some of the medicines which I would like to discuss. These are the medicines which I am showing here, the list of 30 medicines which are used in the first aid kit. And these are the medicines which I usually explain to give the training for the doctors, as well as some of these medicines are also taught to the lay people, where they can keep about 20 medicines in their first aid kit, so that it also creates a awareness. It can also be used as a first aid at their homes or at their workplace. And it is without any side effects. That's the best benefit. So here, Pyramphos 6x, Bryonia 30, Belladonna 30, fever and acute pain. It can be used. Now, when I remember Bryonia, I will also tell you about a case of my relative. Now, she was admitted in the hospital and she had a surgery, and the anesthesia effects were slowly going off. And then she had a trouble with evacuating the feces, and she was not passing the flatus, and the abdomen was, heavy like a stone, and it in the mouth, and the mouth was dry, and she was feeling so much of thirst. Now, all these symptoms lead to bryonia. I gave her a dose of bryonia, and within 15 minutes, she passed the stool. Imagine the condition of a patient on the bed, a surgical bed after surgery, with the effects of anesthesia waning off, and every patient gets these symptoms. Give a dose of Bryonia 30, and you'll find that the patient gets relieved of that, heaviness of abdomen, and passes the feces, immediately. Such a relief for the patient, isn't it? Otherwise, the patient has to wait for 24 hours, and then the next day, maybe she may pass the stool or not. Otherwise, they have to give laxatives or purgatives and all these things, isn't it? This is what happens in the ICU wards. So, such beautifully homeopathic medicines work. Also, phosphorus can be given for the side effects of anesthesia. I have myself given to my patients, some of my patients who were about to go undergo surgeries, a dose of phosphorus. I told them, take this before the surgery, and everything went well. Okay. So phosphorus is also a very beautiful medicine. Now coming to Arnica 31M, fall, blunt and contused injuries. Arsenic 30, gastro-like symptoms after food poisoning, viral fever. Also, Dr. Michael Fraz recommends it for cardiovascular failure, arsenic 30. He has given it in many cases. He writes in his book as well. He writes in his books as well about the cases. Epismel 30 in insect bites, bee stings, scorpion stings. So whenever I am also in a group of trackers where I give these medicines to carry, Epismel, Arnica, okay, and arsenic, Ignatia, Nux vomica, so that whenever they go for the trek, they carry these medicines. Calendula 200 ointment, as well as in dilution or in potency form. Open cuts and wounds with bleeding. That's where it works so beautifully. There is no need of giving any antibiotics. Simply apply the ointment or take the medicine in potency form, and you see that, there is no infection. Okay. There is no need of giving so many higher antibiotics here. Cantharis 30 ointment can be used for burns, and 30 also in dilution in potency form you can give to prevent the complications of burns. Also, if it is deep, then surgical intervention has to be taken. So depending on the gradation of the degree of the burns, one has to identify that and give the medication. Glonine 30 for heat, stroke or sunstroke. Ignatia 30, sudden grief leading to shock. Ignatia, thousands of times I have given for many of the patients, thousands of patients. It works so beautifully. The patient with such a condition that we get frightened by looking at the patient, such a panicky patient. And, such kind of patient, when we inquire that it may be due to some excitement, some shock, or death of near one, or some accident which has happened in their family, we give in Ignatia 30 to 1 m in ascending, ascending potencies. You see that it works so beautifully. The patient, no need. The relatives thinking of the taking the patient to the hospital, stop there itself, say she's well now. Natmure 66, headaches, severe hammering headache, early colds. It can abolish the early cold. The patient feels that now I will get the cold. Viral fever will come. No. So just give natrium numure 6 immediately at the start itself. It will abort that cold. Copulus 30, petroleum 30, frequently we have used it for car sickness, motion sickness. Euphrasia 30, eye drops, eye flu, for eye flu, conjunctivitis. It works so beautifully. So many people have taken this and got cured of this, at the start itself without any complications. Rescue remedy is one of the beautiful remedy for any emergency. You can take it. If you don't find any homeopathic medicine, just take rescue remedy. At least it will work on the mental plane and help the patient to, release the anxiety and be calm. So out of anxiety, most of the people faint, become unconscious. Their heart rate, increases. So rescue remedy helps very usefully. Then is Staphysagrina 30, which is used for honeymoon cystitis. Urtica urens 30, it works so beautifully, especially in the pollen season. Sometimes children come to me, and with so many rashes, red rashes, urticaria over their hands and legs and feet. When I ask them, what did you do? So they had played on the hay, especially in the villages, rural areas, they play on that hay stacks, kept in the village. They go and jump on that and then come. And from the evening onwards, the rashes start, itching starts. Give dose of Urtica urens. You will find that within half an hour, you'll find all the rashes are gone, all the itching is gone. So wonderfully, it helps. And then Rustox 200, sprains due to overstretching, ligament sprains, Magfos 12, abdominal pain, acute abdomen. You can say immediately as a first aid, you can give Magfos 12x. Dissolve it in hot water. You can powder it and dissolve it in hot water and give half cup every 15 minutes. You'll see that the abdominal pain, the colic reduces. Nux vomica 30, hangover after the rich food, alcohol parties, especially for executives, corporate employees who come in the evening or in the morning. They say that lot of headache, I went to the party and this thing happened to me. Vomiting, acidity, hangover feeling, all these things, Nux vomica 30. And that's how it helps. Lead impulse from 30 to 1 m. You can give depending on the depending on the patient's symptoms. It can be used after the lumbar puncture if the pain persists. And next medicine is Symphytum Q. That is used in the mother tincture form, also in the potency form for fractures and eyeball injury. So that's how it helps. Ruta graveolens is also given for bone injuries, ankle injuries. Phosphorus 200 used in epistaxis, hemorrhage, and panicky conditions. So I see some people are waiting in the room.
All are joining, madam.
Okay, sir, you take care of that because it's coming on, popping up
Yes,
on my screen.
yes, because it will come to all uh,
Yes.
co-hosts.
Uh,
We
uh,
will be ready.
Yeah, I continue. Phosphorus 200 is used for epistaxis, hemorrhagic conditions, panic. When we say homeopathy, it has to be given only in, depending on the symptoms, totality of symptoms. Of course, we study the totality of symptoms. We study the picture, we study the different symptoms, and then we give these medicines. Okay, but some medicines can be given as specifics. Okay, remember, in the first aid. Dr. Hahnemann has given us the permission in the organ of medicine. So read those aphorisms which I mentioned, and you will get the understanding there. Then Lecasis 200, septicemia emergencies, infected bites, left-sided angina, pain during swallowing. All these are well-researched medicines. Dr. Michael Franz, in his lecture, had also explained me all these things that this can be used in conditions, such conditions. So Lecasis 200 works very beautifully in acute conditions, such kind of acute conditions. Okay. Then is hypericum. Hypericum, we all know that it's a nerve remedy. So fall on coccyx, injury to the spine and the nerves, any nerve injury, without any doubt, give hypericum. Hypericum, right from in the mother tincture form, also in 6x or 30, works very nicely. Okay. I have given it multiple cases where children usually they get their finger crushed in between the door, and they come crying. So pitiful condition, and then give a dose of hypericum. You see that it heals so fast. Merxol, right side otitis, and in dentistry it is useful. Merxol several times I have given. Pulsatilla, left side otitis, pain, severe pain, left-sided, and other symptoms of pulsatilla. Of course, you can give pulsatilla. Grindalia, arsenic and phosphorus relieves from intubation fast. Now, this is not for first aid, but it is in emergency medicine. You can say in ICU where patient is intubated, and one has to uh, remove the intubation. So relieving the intubation fast, these three medicines work very well. Grindalia, arsenic, and phosphorus. Okay, in ventilation. Natrum sulf for concussion. So any injury to the brain, okay, nat sulf. After effects of brain also it helps. After effects of the brain injury also it helps. Aconite, it's a well-known remedy for us for in case of shock and panic, a violent condition, acute condition, aconite, the kind of restlessness. A Latrodectus maculans 200 is one of the very beautiful remedy for myocardial infarction. Now, all these also play an important role in the ICUs. Carvoveg 200 potency in pulmonary failure. So these are the list of 30 medicines which every doctor should have in his clinic. That's what I feel. Like, in the conventional system, there is a list of emergency medicines which every doctor should have. Even the hospitals have this emergency list of medicines. They have a tray and they keep all these medicines. In a similar way, we should have this, emergency kit ready in such cases where, person comes with myocardial infection. We should diagnose it immediately, give this medicine. At least he stays better till he goes to the hospital or the advanced care comes to help, So these medicines are very important medicines to be kept as the emergency medicine.
Yes, madam. It's very. It is the time for discussion now. Only 5 minutes remaining.
Yeah, sir. Finishing with only 2 slides are remaining now.
Yes.
Uh, so phosphorus, as we discussed, this remedy is very helpful if a person has trouble recovering from effects of anesthesia. And symptoms can include disorientation, stupor, weakness, nausea, and vomiting. And the person may be thirsty, but often vomits after drinking. So these effects we find after anesthesia. Okay. Staphylococcus aureus is also one of the post-operative remedy, and this remedy relieves itching and pain in the surgical area and clean-cut wounds. Also, it is useful. So, causticum also relieves painful scars from burns. Also, post-cauterization. In the surgery, cauterization is done. So, to heal from that, also causticum can be given. And Cinchona officinalis is also one homeopathic remedy which can help due to loss of fluid. It can be diarrhea, it can be bleeding, sweating, with gas in the abdomen. Now, coffea is also one medicine which relieves sleeplessness with worries, overactive thoughts, hypersensitivity to pain. Ferrum phos is helpful for early stages of inflammation and may reduce the soreness and infection of surgery. Another medicine is gelsemium, which helps for a person who feels nervous, has a nervous fear before an operation. There can be trembling, lethargy, and often diarrhea and headache. So that's where gelsemium helps. Rustox, as we discussed already, Thuja is one medicine which is also help for skin lesions, also after effects of vaccination. Silesia is again a very important medicine which can be given for general fatigue with chilliness and lack of energy and irritability. So these can be used in the ICUs and the wards. Now coming for the catheter-induced UTI, that is the COTI. Many times the catheter is kept for 8 days, 10 days, and because of this, the patient suffers. For this, we have good homeopathic medicines to reduce the catheter-associated urinary tract infections. That is where again homeopathy plays a very important role, so that patient doesn't suffer with that catheter. And we can give epismel, cantharis, salix nigra, staphylococcus aureus. All these medicines are there which help to reduce the pain and suffering of the person who is on catheter for a long time.
Okay, madam, just 2 minutes only.
Yeah. So these are my mentors from whom I'm inspired, and I've been, getting so much knowledge from these people. And Ode Sepere, as I said already, have the courage to use your own understanding to apply homeopathy in first aid as well as emergency conditions. I hope that one day homeopathy will be in the mainstream medicine, working for the patients in the ICU as well as in the different wards and as well as in the emergency trauma units. Thank you very much.
Yes, Dr. Rajeshwari Rapta, ma'am. It's as you rightly point out, it will be there. Definitely people will have a kit of this first homeopathic first aid with them in the coming years, because homeopathy is growing everywhere and it is the second largest system that being practiced all over the world. And definitely the Indian government is giving very much importance to this kind of oil systems. Definitely we will get a lot of support from the governments. Anyway, I invite, congratulations for your excellent presentation, and I am inviting Sri Dr. Mohammed Hussain Zaidan and to have a chat, and you can also say the vote of thanks to the session. Please unmute. Please unmute. Yes.
I have this feedback form, sir. I'll put it in the chat box. If you just your copy paste.
Am I audible, please?
Yes, 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 yes.
Yeah, no, thank you very much, ma'am. It is very interesting, and it's solving many clinical cases that cannot be solved by conventional medicine. For example, I have a patient of 84 years old female with a severe urinary tract infection that was Enterobacter species, and it is it is resistant for all antibiotics. It is all drug-resistant microorganism. What do you suggest? Audible?
A urinary tract infection, sir?
Yeah. Am I audible, please?
Yes, yes,
Ah,
yes.
yes, that was urinary tract infection that was Enterobacter species, and it is all drug resistant concerning the antibiotics. How can we help such a patient with a homeopathic treatment?
Yes, so there are medicines like epismel, hydrangea, salix nigra, sarsaparilla, cantharis. Now, depending on the symptoms of the patient, even if the patient is unconscious, maybe is not responding to, is not verbally responding, or he is
No,
bedridden,
she's conscious. She's conscious
conscious.
and she's
Okay.
moving,
So we need to
but
elicit the symptoms. We need to ask her about how she feels, about whether she's chilly, whether she is hot, all
oh
the
yeah,
symptoms.
oh yeah,
We need
oh
to
yeah.
ask all the symptoms, and depending on the symptoms, we need to give the medicine.
Thank you very much.
Observation quality of a homeopathic physician should
Yeah, sure. Yeah, I have another question, please. May I?
Yes,
Yes, sir.
Yes, thank you. Concerning the homeopathic treatment which acts as an antibiotics, do we have in vitro application for those antibiotics concerning the standard microorganisms in order to classify them as an antibiotics or antibiotic analogs?
yes, sir.
Do you do that, or is the principle applicable or is not applicable in homeopathy? Thank you.
Yes, sir. External applications comes under external applications. We homeopaths have already used, calendula as an external application whenever external injuries take place. Calendula itself is a broad spectrum antibiotic. It helps in different kinds of infections, in wound care especially, and apart from that, taking it in, orally, pills like Hepersulf, Cilicia, then you have the Myristica, gunpowder. All these medicines also help
Thank
Oh,
you.
as antibiotics. Also,
Thank-
I also suggest that in some antibiotic resistant cases, homeopathy plays a very important role and can help in
Sure,
antibiotic resistant cases.
sure, I'm convinced of that. Thank you very much, ma'am.
Thank you.
Thank you, Dr. Rajeshwari Rapta, ma'am. It's really an excellent day, and we really enjoyed as well as absorbed everything you shared in this forum from your heart, and we hope we can have some more presentation in the future. Also, thanks to those who attended the session, and hope all of you will be there. Those who missed the session can definitely watch it tomorrow itself on the YouTube, so that you can share these things to your friends as well as you can watch again and again. With
One
that,
more suggestion, sir. Can I? May
yes,
I ask? Sir, if such informative sessions like Dr. Saptarshi's session was there, ECG, it was a very informative session. And I
everything.
recommend that such kind of sessions have to be taken continuously, like in 3 consecutive days for 1 hour each.
But unfortunately, the guests are not available for consecutive days
Yeah,
because
it's very sad that there were very less participants,
no,
for that webinar.
because all are because the same thing will be presented in the next week in English session, so that those who miss can watch again and again. Not only that, we are uploading the same every day, so that those who miss can also watch. This is all of because all our practitioners are all busy in the clinic. That's at the 7 p.m. That is
Yeah, that's the
uh,
that's the
that's the reason why such things happens. Anyway, thank you once again to all. And tomorrow we will have a session from Dr. Rajita Gupta. She is an assistant professor at Pearl University, and she will be discussing about the mind-gut connection, a homeopathic approach to well-being. Thank you, madam, once again. Thank you all. It's over to Dr. P. Shaila to moderate the Malayalam session now.